Let's talk about sexually transmitted infections. No shame, no scared tactics, just real talk about what they are, how they spread, and how to protect yourself while still having a great sex life. Because sexual health isn't about fear, it's about freedom, knowledge, and pleasure. And by the end of this video, you'll know the most common sexually transmitted infections, a few you've probably never heard of, how testing works, how soon you can get tested after exposure, and the best ways to reduce your risk without giving up intimacy. Let's delve right in. Hi, I am Dr. Tangi, the sex doctor, board certified clinical sexologist, and on a mission to destigmatize sex and bring sexual health conversations to the table with the respect they deserve. Welcome to my channel. If you haven't already, why wouldn't you? Hit the subscribe button. Your subscription doesn't just help this channel grow and reach more people, it shows me that you value the work I create for you for free, empowering you to make informed, wise sexual health choices. Engaging with this video through likes, comments, and shares also makes a huge difference. It helps the channel be more visible so we can reach others who deserve these conversations just as much as you do. If you want to support my work even further, check out the icons on this video or the links in the description section. There are plenty of ways for you to get involved. So go ahead and find the subscribe button right now and click on it without shame. You deserve to learn about sex, and I'm here to help you do that. Thank you for being part of this community. So what are sexually transmitted infections? Well, it's infections that you can catch through sexual contact. That includes vaginal, anal, oral, and skin-to-skin contact in some cases. You might have heard the older term STDs, sexually transmitted diseases. We say sexually transmitted infections now because many of these infections don't cause disease symptoms right away or ever, but they still can be passed to others. An infection means a virus, bacteria, or parasite is in the body. It may or may not cause symptoms. A disease means the infection is causing noticeable illness or damage. Many people with sexually transmitted infections have no symptoms at all, but can still transmit them. Calling them infections instead of diseases also reduces stigma and encourages more people to get tested, since it doesn't imply you're sick, just that you might be carrying something that needs medical attention. Some sexually transmitted infections are caused by bacteria like chlamydia, gonorrhea, and syphilis. Some are viruses like herpes, HPV, HIV, and hepatitis. Others are parasites like trichomoniasis or pubic lice. Almost any sexually transmitted infection can develop into a disease if it's left untreated or not well managed. So here's a breakdown for you. Chlamydia and gonorrhea can cause pelvic inflammatory disease in women, leading to infertility, chronic pelvic pain, and ectopic pregnancy. And in men, it can cause epididymitis and fertility issues in men. HPV, certain strains can lead to genital warts or cervical, anal, penile, and throat cancers. HIV, if untreated, can progress to AIDS, and syphilis can progress through stages to neurosyphilis, which is a damaging of the brain and nervous system, cardiovascular problems, and even organ failure. Hepatitis B can lead to chronic hepatitis, cirrhosis, and liver cancer. Herpes, HSV1 and 2, while it doesn't turn into another disease, repeated outbreaks and complications can occur, especially in immunocompromised people, and it can increase the risk of acquiring other STIs like HIV. A brief interruption to remind you that you can talk to me live. Yes, ask me your sex questions directly. You know, the ones you don't dare asking anyone else, or you don't have anyone to ask. Follow the link in the description section of this video to schedule your time with me. Hope to see you soon. Trichomoniasis usually is mild, but can increase risk of other infections and complications during pregnancy. So the infection part is the start. The disease part happens if the infection causes damage, symptoms, or long-term health consequences. And now you know the difference. The big thing to remember, most are curable with medication, others are not, but all of them are manageable with the right health care. The most common STIs globally are chlamydia. It's often symptomless, but can cause pain, discharge, and fertility issues if untreated. Gonorrhea is similar to chlamydia with possible burning during urination or discharge. HPV, the most common viral STI. Some strains cause genital warts, others can lead to cancers. Herpes 1 and 2 can cause blisters or sores, but many people never notice any symptoms. HIV, the virus can lead to AIDS if untreated. Today, with medication, fortunately, people can live long, healthy lives and prevent transmission entirely. These infections that I mentioned before are the ones that are checked more routinely, but those are not the whole story. There are also less known STIs that can still impact your health. Trichomoniasis, also known as trich, is a parasite that can cause itching, burning, or unusual discharge, but often no symptoms at all. Mycoplasma genitalium, an emerging bacterial STI that's harder to treat. Syphilis, once thought to be nearly eliminated, is on the rise again in many places. It progresses in stages and can be very, very serious if untreated. Hepatitis B is a virus that affects the liver and can be sexually transmitted. And there's a vaccine for it. Ureaplasma is a type of bacteria that lives naturally in many people's urinary or genital tracts, often without causing any problems. It's considered a lesser known STI because it can be sexually transmitted, but it's also possible to have it without sexual contact. Most people with ureaplasma have no symptoms at all. And when symptoms do happen, they can include burning during urination, unusual discharge, or pelvic pain. And in some cases, if untreated, ureaplasma has been linked to infertility or complications during pregnancy. The good news is that it can be actually treated with antibiotics once diagnosed through a urine test or a swab. Knowing about these helps you ask for the right tests because not all clinics automatically check for every STI, so you have to ask for them all. You actually have to ask your doctor or the lab for all of these that I mentioned, and I'm going to leave them in the description section of this video so you know what to ask for. One of the trickiest things about STIs is that they don't always show symptoms right away or at all, and this is called latency. Chlamydia and gonorrhea can show symptoms within a week, but many people never show any symptoms. HIV can take 2 to 4 weeks for early symptoms, but blood tests can actually detect it sooner depending on the type. Syphilis, the first sore can appear in 3 weeks, but can be missed. Herpes, the first outbreak may happen within 2 weeks, but can also stay dormant for months or years in the body. This is why regular testing, even when you feel fine, is essential. Testing is quick, often free or low cost, and can be as simple as a urine sample, a blood test, a swab of the genitals, throat, or rectum, or the blisters. And many clinics offer confidential or even anonymous testing. And remember, getting tested isn't an admission of guilt. It's an act of self-care and respect for your partners and yourself. Sex doesn't have to be risky to be satisfying. Here's how to protect yourself without killing the mood. Condoms and dental dams, still the gold standard for STI prevention. Regular testing. If you're sexually active with new or multiple partners, make it a routine. Vaccines for HPV and hepatitis B. Open communication. Talk about testing history, sexual boundaries, and comfort levels. PrEP, a daily pill to prevent HIV, highly effective for people at risk. So, safe sex isn't just about avoiding infections, it's about creating trust, comfort, and freedom to explore without fear. STIs are part of the reality of being sexually active, but they don't have to be a deal breaker for pleasure. Knowledge is power, protection is possible, and great sex is absolutely still on the table. If you found this video helpful, give it a thumbs up, subscribe, share, and join this community. Remember, pleasure and safety are not opposites. With the right information, you can have both. You can have it all. If you're afraid of STI testing, let us know in the comment section why. If you do it regularly, let us know too. As always, I wish you safe, healthy, and pleasurable sex of whatever kind you practice. See you next time.